Frequent urge to pee, post-void dribbling, pain in the pelvis or testicle, or painful erections, even if the urologist says everything is fine. This is one of the most frustrating situations a man can face. There are symptoms, but the tests are normal. Here is what many don't realize. A normal test result doesn't mean there isn't an underlying cause. It means you haven't looked in the right place. Today, I'm asking a pelvic floor specialist the question that men are afraid to ask out loud. Could all of this be caused by the pelvic floor? If you've gone from one doctor to another without answers, watch this to the end. Describe the typical man who ends up in your office, and where has he usually been, for appointments before he comes to you?
Well, a typical man is someone who has suffered from symptoms for quite a while. It could be years. And usually there's been a urological exam, and there might have been a gastroenterological exam, and like various doctor visits, occupational health, general practitioners, and all sorts, before the idea starts to emerge from somewhere that maybe they should go to pelvic floor physical therapy. So yeah, that's a pretty typical case.
So, frequent urge to pee, post-void dribbling, weak stream, pelvic pain. Can that same pelvic floor be behind all of these?
It can be, yes, indeed. Of course, there can be various reasons why those specific symptoms are present. Just as with women, men can have weakness in the pelvic floor. There can be tension, there can be prostate issues like enlargement, for example, and things like that. And of course, pressure regulation challenges as well.
Well, when urological tests are normal but all the symptoms persist, what should one think then?
Well, I think that if nothing organic is found, and many have had their intestines examined, for example, before they come to my office, then I think at some point it would be a good idea to gently raise the question, could this actually be perhaps something muscular? Because, when we talk about the pelvic floor muscles, if there's a muscle imbalance, meaning that everything in that area is not quite functioning as it should, or things are just a little bit off, then those imbalances can actually cause surprisingly severe symptoms. So it's definitely worth considering the muscular aspect as a possible factor here, and specifically various pain symptoms, which many then get a bit scared of. So especially thinking about professionals too, it would be good to keep in mind that it can be muscular, and there are professionals like us who specialize in that area.
Well, how can an overactive pelvic floor cause these symptoms even though nothing is actually found in the body?
Well, it can cause it in a way that if a muscle is constantly in such a state of tension and load, it can go into a spasm, so to speak, meaning a very strong state of tension occurs. And that then causes the pain. So it can happen, for example, during an erection, or when you need to have a bowel movement, then the muscles fight against that movement, or situations like that. Or something like cycling can trigger it because there's already load and friction in the pelvic floor area. So it further worsens the tension that's already there, and then it becomes very painful afterwards.
Now that these seasonal issues are popping up, like snow shoveling in winter causing lower back pain, and tire changes in spring and autumn doing the same, do you see a spike in cyclists at your clinic now that the summer season is here?
Well, cycling does come up quite often. Once people have been cycling for a bit and the season is well underway, those pelvic floor symptoms start to appear. Another factor is the winter cold, which can also trigger pain.
What kind of symptoms do clients typically experience from cycling?
Well, it's usually described as pain, which can be in the perineum or the testicular area. It can also radiate to the inner thighs or the lower abdomen, so it can feel quite widespread. You might not even realize it's purely the pelvic floor. It can affect the surrounding tissues too, and there's often a sense of pressure as well.
Can the pelvic floor affect the control of erections or ejaculation even without any clear pain?
Yes, it certainly can. Since those particular functions involve muscle control, if the muscles are constantly tense and tight, then control is naturally going to be weaker than if they were relaxed. Being able to consciously relax and then activate those muscles usually has a noticeably positive effect on things like erections.
When should chronic prostatitis or CPPS be reconsidered from a pelvic floor perspective, especially if antibiotics haven't provided any relief?
Well, I think exactly in those cases. I see many clients who have taken numerous courses of medication for chronic pelvic pain or chronic prostatitis. They have often been on these medications for years, but unfortunately the problem just keeps coming back. Yeah. In situations like these, there must be something more going on than just inflammation alone. We have helped many clients move forward by introducing pelvic floor physiotherapy, which can really help break that ongoing cycle of inflammation, especially if the underlying cause is actually muscular in nature.
Right. So, what would you say to a man who's hesitant to come in because he feels it's embarrassing or just a women's issue?
Well, everyone has a pelvic floor, so it's good that it's being talked about much more. If I think about my career over the last 10 years or so, there's been so much more talk about the pelvic floor, but it's mostly been focused on women and symptoms after childbirth. But since men have the exact same structure, it's not any more shameful for a man to have symptoms. So definitely don't be afraid to come in. It's very common for men to have these issues too. So why wouldn't you get it treated? It's not embarrassing at all. It's not something to be ashamed of, at least in my opinion. Just as it can lower the quality of life for women, it can do the same for men. And there's a lot of evidence that it has a huge impact on men's self-esteem and sexuality and things like that, especially if those problems have persisted for years.
If you think about the prevalence of jaw problems, for example, which affect 8 to 10% of the population, how common are these kinds of pelvic floor issues among men in the population? Is there any data on that?
I don't really have any exact percentages to give you right now regarding the proportions. I think there's a lot of hidden prevalence. So in reality, it's much more common than we might guess. And this is also reflected in the fact that clients might come to my clinic with a sort of hidden diagnosis. They might come in, say, for back pain, but then we start talking about the pelvic floor, or they come for an arm issue or jaw problems, but we end up discussing the pelvic floor. So maybe that illustrates that it can be difficult to seek help using the actual, names and terms. It's only when they see a professional who specializes in the field that they finally start talking about what's really going on. So I think many people suffer from various pelvic floor challenges, but they're just too embarrassed to go and seek help.
What can a man expect from his first visit to a pelvic floor physio? Is an internal examination always necessary?
An internal exam isn't always necessary, as we have many different ways to start investigating the situation. Of course, everything always starts with a good, thorough interview, so we can get a sense of what might be going on here. Well, internal exams are one option, but then at some clinics, like mine, for instance, I use ultrasound a lot, a diagnostic ultrasound where we can see the state of the pelvic floor and muscle function through the abdominal wall. But I also like to work by going straight into trying out exercises. So if I have a suspicion that, this could be a case of a tense pelvic floor, for example, then we can also start directly with exercises. And we'll see how those exercises work, what kind of response they bring, and then various other examinations, more detailed ones, can be done later as needed. But I understand that it can be a bit scary, like not even wanting to go to the clinic if the examination feels uncomfortable. But of course, all examinations are always done in agreement with the client, so we don't do anything that feels unpleasant.
Well, could you give one concrete example related to breathing or relaxation that a man could try today?
Everyone could try this. When you observe your breathing, can you feel the breath with your own hand all the way down? In the lower abdomen, lower back, and even as far as the perineum. So if you feel it there, that's good. But if you don't feel it there, you could start to guide it towards it. Because if breathing is shallow and it's really high up here, then the pelvic floor has a chance to be in that state of support and tension all the time. And that's not the goal.
Well, if the viewer remembers one thing from this video, what should it be?
Well, it's probably that there's nothing so shameful that you couldn't come to the clinic. Because when help is available for these problems, as I said at the beginning, muscle-related problems can cause surprisingly severe symptoms. But it's good that we can treat those muscle-related problems very effectively. We have a lot of ways to start working on that issue. So it's better to come to the clinic a bit too early than a bit too late.